In this lesson, we will study Chapter 20 External Causes of Morbidity, covering code range V00 through Y99. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Learning objectives. By the end of this lesson, you will be able to explain the purpose of Chapter 20. Apply general external cause coding rules. Assign correct seventh characters. Use place, activity, and status codes appropriately. Apply sequencing rules for multiple external causes. Differentiate intent categories. Apply abuse, terrorism, and sequela rules. And avoid common CPC exam errors. Purpose of Chapter 20. Chapter 20 codes are not diagnostic codes. They exist to explain how an injury or condition happened. These codes capture the cause of the event, the intent, the place where it occurred, the activity at the time, and the patient's status, such as work or military activity. These codes support injury prevention and public health research, not medical diagnosis. Principal diagnosis rule, exam alert, a critical exam rule. External cause codes can never be the principal or first listed diagnosis. They are always secondary codes and must follow a diagnosis code that describes the actual injury or condition. This rule is tested frequently on CPC exams. Reporting requirement. There is no national requirement to report external cause codes. However, some states mandate reporting. Some payers require them. Even when not mandatory, voluntary reporting is encouraged due to the value of these codes in injury surveillance. Conditions that may use external cause codes. External cause codes may be reported with diagnoses from A00.0 through T88.9, Z00 through Z99. They are not limited to injuries. For example, they may describe a heart attack that occurred during strenuous physical activity. Seventh character application. Most Chapter 20 codes require a seventh character. A. Initial encounter. D. Subsequent encounter. S. Sequela. The seventh character must match the seventh character of the related injury or condition code. This matching requirement is a common exam trap. Full description rule. Coders should use the full range of external cause codes to completely describe cause, intent, place, activity, status. Assign as many external cause codes as necessary to clearly explain the event. Selection of external cause code. Selection of the correct external cause code is guided by the alphabetic index of external causes. Inclusion and exclusion notes in the tabular list. If reporting is limited to only one external cause code, assign the code most closely related to the principal diagnosis. Combination external cause codes. Some external cause codes describe sequential events, such as a fall that results in striking an object. Assign the combination code that represents the entire sequence, regardless of which event caused the most severe injury. When no external cause code is needed. Do not assign an external cause code when the cause and intent are already built into another code. Example: poisoning codes in T36T50 already include intent. Place of occurrence, Y92. Place of occurrence codes identify where the event occurred. Key rules. Assigned only once. Usually at the initial encounter. No seventh character is used. Do not assign Y92.9 if the place is not stated or not applicable. Activity codes, Y93. Activity codes identify what the patient was doing at the time of the event. Rules. Assigned once. Only one Y93 code per encounter. Used only at the initial encounter. Not used for poisonings, adverse effects, misadventures, sequela. Do not assign Y93.9 if the activity is not documented. Status codes, Y99. Status codes identify work or military status at the time of the event. Rules. Assigned once. Used only at the initial encounter. Used only when other external cause codes apply. Not used for poisonings, adverse effects, misadventures, or late effects. Do not assign Y99.9 if status is not stated. Sequencing order. When multiple external cause codes are used, sequence them as follows: cause and intent codes. Place of occurrence, Y92, activity, Y93, external cause status, Y99. Multiple events. If multiple events cause separate injuries, assign an external cause code for each cause. The first listed external cause code must follow the established priority hierarchy. External cause priority hierarchy, exam favorite, priority order, child and adult abuse. Terrorism, cataclysmic events, transport accidents, other accidents or self-harm. Always select the external cause related to the most serious diagnosis. Abuse guidelines. Abuse, neglect, and maltreatment are classified as assault. For confirmed cases, assign appropriate assault codes. Add Y07 perpetrator code if known. For suspected cases, different rules apply and external cause codes may not be used. Unknown or undetermined intent. If intent is unknown, default to accidental intent. Codes for undetermined intent are used only when documentation clearly states that intent cannot be determined. All transport accidents are assumed to be accidental. Sequelae of external causes. Use external cause codes with 7th character, S, only when a late effect exists. Do not use sequela external cause codes with a current injury. Subsequent visits. Sequela external cause codes are used only when treating a late effect. They are not used for routine follow-up, healing, or rehabilitation unless a sequela is documented. Terrorism guidelines. When confirmed by the FBI, assign Y38 first. When suspected, do not assign Y38. Code as assault. Secondary effects of terrorism are coded with Y38.9. Common CPC exam errors. Common mistakes include using external cause codes as principal, mismatched 7th characters, overuse of unspecified codes, incorrect use of sequela codes, ignoring priority sequencing rules. Exam recall summary. Remember, external cause codes are never principal. They explain how, not what. 7th characters must match. Only one Y92, Y93, and Y99 per encounter. Abuse and terrorism take highest priority. Sequela codes are for late effects only. Lesson 22 Summary. In this lesson, we covered the purpose of Chapter 20, general external cause coding rules, place, activity, and status codes, multiple external cause sequencing, abuse, terrorism, and sequela guidelines, and high-risk CPC exam pitfalls.